We all know that cigarette smoking can cause cancers, heart problems, lung problems, and even cerebrovascular stroke. But do you know that it can screw up your orthopedic health? That is, it can screw up your bone and joints as well? Yes. I will just share a few things that it can do to your bone and joint health. Smoking reduces density of bones and makes them more fragile and as a result more prone to fractures. This can happen in all age groups. Nicotine, which is present in cigarettes, decreases blood flow and oxygen to the bones and joints, and as a result, there is delayed fracture healing after injuries. Also, smoking can cause disc degeneration and as a result, herniation and chronic back pain. This kind of pain is often not responsive to normal treatments. Smoking also accelerates cartilage degeneration in the joint. Now, cartilage is the cushion that protects the end of the bone that form a joint. Due to the degeneration of cartilage, arthritis is often accelerated in these patients. It also increases the chance of infection after any kind of surgery. The surprising thing is, we often think that this will happen only after a certain period of smoking, that this could happen after 10 to 20 years of smoking. But that is not the case. We have seen patients in their 20s and 30s also experience these side effects. So the next time you feel like having a smoke, try detox water instead and it will really be helpful. Thank you.